Hi, I'm Tammy Potter, and welcome to the Pregnancy Process Podcast, a show designed to help you navigate the hugely transformative journey to motherhood, where you'll hear the unique experience of experts in this area and the incredible stories of women sharing their conception, pregnancy, and postnatal journeys so that you can have a healthier, more informed pregnancy. In today's episode, I talk to leading pelvic health physiotherapist and founder of Sydney Pelvic Clinic, Dr. Angela James. Dr. James holds a specialist title from the Australian College of Physiotherapy in recognition of her clinical achievements. She's a casual lecturer at the University of Melbourne, running masterclasses for pelvic girdle pain. She also conducts courses both locally and internationally for practitioners on the pregnant pelvis, coccyx and perianal pain, and pelvic organ prolapse. In this engaging episode, we unpack the biopsychosocial model, a holistic approach that examines how biological, psychological, and social factors intertwine to impact pelvic floor dysfunction. Dr. James explains the critical role of the vagus nerve in regulating bodily functions. She also discusses how chronic stress can disrupt this communication, leading to issues like bladder and bowel dysfunction. We explore the concept of interoception, the body's ability to sense its internal state and its connection to pelvic health. This episode is a must listen for all women, whether you're trying to conceive, currently pregnant, or navigating the postpartum period. Dr. James's expert advice will provide invaluable insights to support your journey toward optimal pelvic health. Angela, thank you so much for your time today. It's fantastic to have you here with us.
Thank you for inviting me. I'm looking forward to the conversation.
I know, same. And this is a topic that I know is really close to your heart. And I know there's so much interest around the vagus nerve, stress, how it relates to the body, the pelvic floor. So this is an episode that I've been waiting to do, I think, waiting for the right moment. So I'm very excited to have this conversation. And I think the best place to start would be with what actually is the biopsychosocial method and how does it apply to pelvic floor dysfunction?
Okay, yeah. So the biopsychosocial model of healthcare is really looking at a human with all its complexities and figuring out what is a particular symptom or dysfunction. So if you look back maybe 20, 25 years, healthcare used to take more of a biomedical model where it was quite simplistic. And I guess a really good example of a biomedical approach would be looking at a UTI or a bladder infection where the symptom, urinary frequency, pain on passing urination, and then there's a test showing a bacteria, and then there's a antibiotic and that gets rid of it, and then we go back to baseline and there's no more complexity. But in reality, we know that it is more complex than that because it is related to a human and a human's experience and response and memory and history. And so what we know that really goes on with a lot of people is that there is a response in the viscera, there's a response in the muscles, there's a response in the nervous system. And some people have more of a persistent response to something like a UTI where the symptoms can stay on much longer than what the inflammation or the bacteria indicates. So this is where we need to look at things about the muscular response. So in particular, for this particular situation, the pelvic floor and the abdominal area, and the social constructs, supportive relationships, effect on intimate relationships, maybe workplace relationships, how that person can perform and engage in their work, and then psychological constructs, whether it triggers feelings of shame or embarrassment or anxiety or stress or catastrophic thinking. And so the biopsychosocial model looks at situations in a much broader perspective. And really the skill of the healthcare professional is to be able to assess every possible factor and then work out whether it is helping, like a supportive social relationship, or it's actually hindering, such as amplified anxiety or high stress levels or something like that. So in essence, a biopsychosocial approach is really seeing things as they are and making sure that we're not ignoring some really significant influences on a person's ability to recover and to stay well.
Now, you've mentioned in there assessing every possible factor. What does that look like from a pelvic specialist's perspective?
Yeah, so it's not as easy as just doing a urine test and seeing if there's a positive marker there or not. So a true biopsychosocial assessment includes what people would probably already know that we do, which is a really great physical assessment where we assess things like tone and strength and weakness, areas of pain and sensitivity. It also looks at psychological testing, and so that can be done in a number of ways. It can be like direct questions, so good history taking is a really important skill. And we also use a lot of screening forms. So we do some pre-screening to get an indication of general levels of nervous system state and level of distress. And then we can do more specific screening if it's relevant, where we can look at constructs like stress, anxiety, catastrophic thinking, fear, levels of self-efficacy. And then when we're having discussions with our patients, we're actually doing that to develop some understanding about the social world that they live in, their relationship status, how they're feeling about their work, if they have a support network or not. So through over a course of an initial assessment, and sometimes if it's more complex, a number of assessments, we start to gather all the information and make decisions around what is the big levers that need to be addressed to start to change the state and to improve whatever it is, whether it's pain or function of the patient that we're seeing. And it's very individual. Of course, everyone's a snowflake, so there's no particular template, but that's generally how we would go about assessing each possible contributor and then making a decision about what is the likely contributing factors at that particular point and addressing that.
Because pain and function, there's so many things that can weave into that. And that's exactly what you're talking about. You're talking about looking at it in a multidimensional way rather than just like a flat, okay, it's only got to do with the symptoms. It's looking at all the other potential contributing factors to those
That's
symptoms.
right. So just instead of just looking at the end organ, so perhaps we'd say instead of just looking at the pelvic floor and making a judgment about what the pelvic floor is doing from a very local perspective, we're looking at the pelvic floor in relationship to the environment that it works within, and that's the nervous system, the history, and the social constructs. Because we often will say that the pelvic floor and pelvic health is like the barometer of the nervous system. So it's not enough just to know what's going on at the local level of the pelvic floor.
So let's talk about the nervous system, because you've mentioned that a number of times. So how does the autonomic nervous system, or particularly the vagus nerve, regulate bodily functions in relation to the pelvic floor and in relation to pelvic floor health?
Okay, so the autonomic nervous system is really the communication channel that happens between the brain and the body. And the vagus nerve is the longest cranial nerve in our body. It's the 10th cranial nerve. And vagus is Latin for the wanderer. So it's a really apt description of what the vagus nerve does. It wanders from the brain down into the viscera, and it is responsible for communicating between the viscera and the brain. And it helps to regulate the response in combination to the assessment of whether our system has a sense of safety or threat. And so it will either trigger a parasympathetic or a sympathetic nervous system response. That's the autonomic nervous system. It's made up of the three systems, actually: the ventral vagal, the dorsal vagal, and the sympathetic nervous system. And depending on what the assessment is in terms of threat versus safety, it will drive up either one of those systems. And we know that the vagal nerve flourishes when there's a dominance of a parasympathetic system response or a safety response, so that there can be really accurate connection between our body and our brain. So in terms of how that relates to pelvic health, so we know that pelvic floor, the bowel, the bladder, sexual function, the sex organs all get innervation by both systems. And so it depends on what needs to happen. So if we're talking about engaging intimately, we need to be in a relaxed parasympathetic nervous system state. If we want to empty our bladder and bowel, we need to be in a very similar state to that. But if we want to run away from a threat, we need to actually stop all of that from happening, and we deprioritize things like filling our bladder and digesting our food, and we mobilize an enormous amount of energy and focus to send energy to our peripheral muscular system to be able to take some sort of actions. They're all normal systems. They're all adaptive to the environment. And if it works into proportion with what's happening in our environment and our goal of that particular moment, then everything's all good. But it gets disrupted when we have dysregulation in the nervous system state, and it starts to work against what the goal is in that moment. So, for example, if we want to go and empty our bladder or empty our bowel, and we're in a sympathetic nervous system state where we're prioritizing a flight-fight response, our pelvic floor muscle will be tight, and that works against the task of emptying bladder or bowel. And so very often we need to be working as pelvic health therapists with both the nervous system and the pelvic floor muscles to elicit the response that we need. Yeah.
It's so interesting, isn't it? In my head, I'm thinking about how this relates to birth and just the fact that as humans, we are in this constant busy cycle, and we've got this low level stress that many people, unless they're actively doing the well-being steps to down regulate their nervous system, and they're sleeping and ticking all of those boxes, which is very hard. It's like a full-time job to tick all those health boxes. Many of us are living in that constant low-level stress. Some of us are quite acute, and then you've got people that are living in that chronic, ongoing, stressful environment of modern life. So when you look at it from this perspective, and then how it flows on to all the rest of their health, like talking about not emptying your bladder properly, not emptying your bowel properly, it's just like this flow-on effect. So it's incredible, isn't it? So in terms of specifically pelvic floor function, how does that vagus nerve influence the pelvic floor?
So the vagal nerve function, if the vagus nerve is flourishing, we've got high heart rate variability. That's the measure that we can determine whether we've got high vagal tone. We have communication happening into things like filling the bladder, like digestion, and being able to access pelvic floor muscle relaxation. And we've got connection, which is a really important component as well. So say we don't have adequate vagal tone, we lose that nuanced function in our pelvic organs. And we also can lose somatosensory connection. So our body's accurate sense of what's going on. So we know, for example, with trauma or with pain, we get a smudging of the somatosensory cortex, which is if you looked at a beautiful map that's clear and you can navigate your way through it and get from A to B because everything looks clear and accurate. That's really great somatosensory mapping or connection or organization, where dysregulation in that area is kind of like we've spilt coffee on the map and it's there, but we can't quite connect the dots and we can't quite orientate ourselves. And that kind of feeling of disconnect in our body creates stress, and it can really interrupt normal function because we're not getting the same feedback. And the term that's used for that kind of feedback or communication from our viscera up into our brain, and then our brain's accurate response is interoception. So when we feel safe and when we've got good vagal tone and we've got good connection, we've got high levels of interoception, which is our body's sense of what's happening inside. Yeah, and that's a good feeling. That's when people feel comfortable in their bodies and they function at their best. But if that's interrupted and we've got poor interoception and we've got low vagal tone, we've got low somatosensory connection, then there's a real sense of disconnect and distress. And that's often what we find with patients with persistent pelvic pain or pelvic dysfunction.
So interesting, isn't it? And then, of course, you've got those kind of like neurobiological mechanisms as well. Can we talk about some of the like neurobiological mechanisms that link the stress and the vagus nerve and the pelvic floor together? Is that a thing? Or is it all the same thing that we're
It's
talking
all
about?
processes that occur that would be talking about what's going on in that autonomic nervous system. And I guess the downstream effect is what happens into pelvic health. Yeah, when we're in high stress, we're in sympathetic nervous system. We're mobilizing energy, we're preparing to attack or to flee, fight or flight or flee. And when we're in low stress, we're in a more relaxed state and we've got that parasympathetic or ventral nervous system response. And that's really our social engagement system. So, in essence, we are wired to connect, absolutely. So, that like oxytocin that occurs, so instead of adrenaline and cortisol, which is the sympathetic nervous system hormones, where we're really flooded with oxytocin, which is a bonding hormone. And that's really humans at our best. So that's when we feel connected. That's when we feel safe and orientated and curious and able to take on new and novel challenges. Yeah, good things happen when we're in ventral vagal. That's humans at their best. And so these systems are all interlinked, and it's really linked in also to our immune response. So we have high levels of immune function when we're spending a lot of time in ventral vagal, and our immune system is very much compromised when we're in a chronic state of sympathetic nervous system, which is starting to become disproportionate to just, threat in the present moment, where we've got a threat-based response. Even if we're in a safe environment, our nervous system is still responding like we're threatened in the moment. That's when health issues become really significant, when our nervous system isn't able to regulate and pendulate back into that restorative mode. So we've got high levels of inflammation, we've got low levels of immunity, we've got high levels of pain sensitivity. So you can start to see why it's so important as a healthcare professional is to be able to understand and work with the autonomic nervous system, because if we miss that and it's a significant driver of the end organ presentation, then we're not going to be very effective in shifting things for the patient for any length of time. So, yeah, it's a key factor to not just understand, but also be able to build awareness and education. And then, of course, strategies to help to promote a healthier nervous system response.
Because it's interesting, isn't it? I know you've mentioned HRV previously in terms of it is one of the key indicators in terms of how your nervous system is actually responding to your stresses in life. And I think about someone that I'm working with at the moment, and they're dealing with some chronic inflammation and chronic fatigue. And so every time I see them, I'm like asking how their HRV is doing, how their resting heart rate is overnight. And it's that whole immune system function and the pain sensitivity, like all these things that you're talking about. In my head, I'm like, oh, that's ticking the box on that one. And that's ticking the box on that one, especially the pain sensitivity. If someone's always in that fight flight response and their muscles are always tight and like on, and there's pain and everything hurts all the time. And it's also like understanding that these things aren't normal and there's a bigger global picture going on, and it's not just about one thing. There's so many things playing into that. And definitely, I mean, you've mentioned also trauma in there as well. But I think let's first start with kind of some of the more psychological factors that might be associated with pelvic floor dysfunction.
Yes.
Seeing we're in this realm anyway, because there would be definitely some psychological factors
Yeah,
playing into
there
this.
certainly can be. So, from a pain perspective, if we're looking at persistent pain, we know that persistent pain tends to be associated with dysregulation in the nervous system. And when we talk about dysregulation in the nervous system, I guess in simple terms, it's a balance of safety and threat. So if we have like higher stress and higher pain sensitivity, we tend to be in a place where we're perceiving threat a lot of the time. So as you just mentioned, that has a downstream effect in terms of muscle tension and nerve sensitivity and exhaustion, because it's really takes a lot of energy to be in a defensive response for a prolonged period of time. And so from a pelvic floor perspective, that's when we normally see patients with high tone pelvic floor. And that can mean pelvic pain, so pain anywhere in the lower abdominal, genital, perineal, perianal area. And despite no pathology, so UTI test is clear, endo's been like removed or cleared from being in play. There's no, swab that could, or scan that could show that there's pathology. So there's no evidence that there's any pathology going on, but pain persists despite that. We also would see things like problems with emptying the bladder and the bowel effectively. So people could have incomplete emptying or slow stream with the urine, or frequency and urgency, because we know that when we're feeling stressed, anxious, or worried, we tend to have a lower threshold to feel volume in our bladder, like that need to go to the toilet if you're really nervous, even though the bladder's not that full. We can also see the same state with emptying the back passage. So people can have either pain on emptying or incomplete emptying. They can have recurrent fissures. They could have recurrent hemorrhoids. They could start to have constipation, chronic constipation, and of course sexual functions in there as well. Pelvic floor doesn't necessarily relax on command. Women can experience pain on attempts of penetration, or sometimes it's not possible, or perhaps it's more with depth of penetration. And men can also experience sexual dysfunction, like inability to gain and maintain an erection, or pain with ejaculation, and that level of disconnect into their genitals. So there is a lot of ramifications from being in a sympathetic state to what ends up happening downstream in the pelvic bowl. Yeah.
Sounds like just one of those vicious cycles, right? Like, 'cause you can imagine if you were feeling this and there was no specific cause of it that they could find, you'd be worried, you'd be stressed about that, and then it would just feed into itself consistently.
Yeah.
Especially if they're like, all of those things that you've just described would be quite stressful
Yeah.
for someone. And when they're in an already stressed state, which is what's causing it, and there's no real reason for it. Because I think sometimes when you can pin a reason on something, it makes people feel like there's a pathway, right? We actually know what's wrong. This is the steps that we take to fix it. Whereas if they've done all the tests and checks and it's still coming back, there's nothing, even that would probably be quite stressful in itself. It's the unknown, like what's actually going on with me. So even just pulling out, hey, it could be something else going on in the background that's causing all of
That's
this.
right.
So I think even just bringing awareness to this is so important.
100%. And you're right there. We know that when patients understand what's going on, or people understand what's going on, and in that case, that it's not reflective of tissue damage or tissue trauma or disease or pathology, it is still pain. It's not real, but it's more reflective of perhaps what's happening in the nervous system, the perceived threat, and the muscle response, and how that can cause a cycle of pain. And patients can really start to move into more positive action about addressing those factors. And that's when you start to see the game change for patients. Because instead of staying in that worry, concern, anxious cycle and being almost stuck in that because of not knowing any better, they start to move towards taking a positive action, change the game in their nervous system and their muscle response and their understanding. So we know from evidence that education is really powerful. If we did nothing with our hands and we accurately help the patient make sense of what's going on with them, we know that they're going to have a good outcome once they really understand and they can start to connect the dots. And of course, if we can add some action steps that is tailored to their situation and can promote adherence to them, like sticking with things that are really helpful, then we know they're going to do really well over time. And if we miss that step, and if we just say treat a muscle in a very local way without linking it into that bigger picture, or without helping them sense make of their symptoms, we know that's pretty low value healthcare, because it doesn't take into account the whole picture. And patients do much better when it's seen as a whole picture, because that's seeing things as it is.
It's almost like that treating the symptom, not the actual problem, that Band-Aid over a broken bone. If you're literally just treating if this is the underlying cause of what's happening and you're just treating the physical symptoms, it would be like you'd unwind it and would just wind up again. Unwind, wind up. So it would just be like, why is nothing changing? Why is nothing changing? And it's because nothing has changed.
Yeah, that's right. What's driving hasn't actually turned off switch. That's exactly right. Yeah.
You have mentioned trauma. There would be implications of like physical / emotional implications of trauma on pelvic floor health.
Yes.
And I'm sure it doesn't even need to be physical sexual trauma. It could probably be all types. Can we talk about that? And obviously we're going into quite a sensitive topic. So if this is triggering for anybody listening, we'll try and tread carefully around this.
Yeah, so we know that the pelvic floor muscle itself is an emotional first responder. So it responds very much to fear. So if there is a state of fear in the body before you've even registered that you're feeling fear, your pelvic floor muscle has been shown to tighten, and so has your upper trapezius. So there are two muscles that have a highly reactive response to fear. So that's one thing. And say it's not even the trauma event itself. There's lots of different types of trauma. And I guess specifically for pelvic floor health, we would be looking at birth trauma or sexual abuse trauma. But it's not just those big traumas. There can be lots of other things, like an unpredictable home environment is another one. The pelvic floor can be held in a constant state of tension because their perception is the environment that either they're living inside their body or the environment that they're actually living within perceives threat, constant threat, or unpredictability and not adequate levels of safety. So trauma persists because of that ongoing threat response and the inability to connect into safety within their body or their environment. And when that happens, we'll have all of the different ramifications that go on when the pelvic floor is held in a state of constant tension. So that, as we've already talked about, it can look like bladder dysfunction, sexual dysfunction, bowel dysfunction, gut dysfunction. The good thing to know is that those states can change. People do heal from trauma, but looking at that connection between how the nervous system is functioning and how that leads down into changes within the pelvic bowl and that connection back into the body in a safe way lies at the heart of healing from trauma and reestablishing safety and connection in the body.
You just mentioned gut dysfunction in there. So how does this, and I guess that would be like gastrointestinal health, how does all this work in? Because we know that our gut is our second brain. How does what we're talking about weave into gastrointestinal health?
Yes. So your connection into your gut is largely through the vagal nerve, and nerve supply into the enteric nervous system flourishes when we're in more that parasympathetic state. So when we've got that high vagal tone and that connection from brain into body, and we're in a parasympathetic nervous system state, we know that digestion is optimized. So that's when we can prioritize moving our food through our digestive tract, gaining nutrition, and that's good. So when we are in more of a constant state of stress, we can't do both. We can't be stressed and flourish in our digestive tract. So a lot of the time when patients come to see us and they've got IBS or gut pain or constipation, we will still see that relationship into a activated nervous system response or a stressed nervous system response. And we need to make sure that alongside of looking at diet and exercise and like pelvic floor relaxation and things that aid correct action, we're really making sure that the patient understands the link between gut function and nervous system state. So we're deliberately evoking the relaxation response and deliberately winding up the parasympathetic nervous system. So we'll have a lot of conversations with patients around that. So it's not just what food you put in, although that's really important too. It's the state, it's the environment that food is entering into that can make the difference. And a lot of the time, by the time people come to see us, they've done all of those things. And the missing piece is that regulated nervous system, or that parasympathetic state, to make sure that the gut can do its job effectively.
It's interesting that you mentioned IBS there, because a lot of the times when people, again, it's that when people don't know, it just gets put down to IBS. So IBS is that kind of like umbrella term for, we don't actually know what's going on with your gut, so we're going to name it IBS. But what you're saying right now is that actually there could be definitely a stress sympathetic nervous system factor that's actually setting your gut symptoms off, and that it's maybe not so much a nutritional, there will be some type of nutrition aggravation to it, but let's look at some of your stresses, lifestyle factors, all that type of thing that could be feeding into it as well.
It's so true, and so important that the patient understands that. So we try and help people actually look more holistically about what's going on. So if they have IBS symptoms, they can look at their food, they can look at their stressors, they can look at their sleep, they can look to see what's happening in their relationship, what's happening at work, and start to work out, actually, you know what, my food is fairly consistent. That doesn't seem to be a problem there. I've optimized that, but I actually have been really stressed at work because of A, B, and C. And I can see now the link that my gut is more prone to being sore when these stresses are happening. And so then people then start to understand the importance of looking after that nervous system component. And that can be reducing stress, exercise, mindfulness, meditation, safety, that there's no pathology, there's no disease, that the pain doesn't mean that there's something wrong. It can mean that the nervous system is a little dysregulated and needs to be down-regulated so that gut can function optimally. And that's often the missing piece. And we know through research that gut hypnotherapy, which is really looking at that piece, can be more effective than something like the FODMAP diet. So not to say that the diet's not important. We know that the nutrition is a key pillar for health, and having a really healthy gut microbiome is key. And that really links to lots of different things like immunity and mood and things like this. But I think people understand that piece probably better than what they understand the role of the nervous system. So it's good to highlight that for people that have IBS, that they really need to look at the nervous system component as well to get best results.
And isn't that interesting? Hypnotherapy, it's incredible, isn't it? Hypnotherapy for your gut health. But you have mentioned sleep. And for anybody that knows me, they will know that I'm an absolute sleep freak. Sleep is so important. So what's the relationship, and how does sleep quality affect your pelvic floor health and, of course, the vagus nerve activity? How does all that kind of go in together? And you've mentioned HRV as well. So let's talk about
Sleep
that.
is another key pillar. We've got exercise as a key pillar. We've got sleep as a key pillar. We've got nutrition as a key pillar. We've got social connection as key pillars to health. And in terms of sleep, we know through research that poor sleep is related to pain sensitivity, and pain sensitivity is related to poor sleep. So these two things are really interconnected. And so say we've got a patient with persistent pain and they've got really poor sleep, which could mean either delayed sleep onset, so taking too long to fall to sleep and not being able to stay asleep over a prolonged period of time. Then one of our first things that we will do is we'll look to optimize sleep, because we know if we can't get sleep right, we're not going to change pain sensitivity. So when we sleep, that's when we do a lot of our restorative processes. So that goes on a brain level. So it helps our memory, it helps our learning, it helps to reduce inflammation, it helps to promote that visceral functions, our bladders, our bowels, our digestive system, reducing sensitivity. Sleep is a wonder thing to happen, and we do all of these magical processes where we're in this deep restorative sleep. So if we can't change that, we're not going to change a lot of the dysfunctions that can happen secondary to not having enough time in this restorative state. So you're right to be a sleep freak, and it's really great that you're bringing that into your training sessions and making other people aware of how important sleep is for our overall well-being. And for us as pelvic floor physios, we're looking to optimize the whole system function to make sure that end point, bladder, bowel, sexual function, pelvic floor health, is actually able to flourish and do normal things. So poor sleep can interrupt every system, and I guess pelvic health is no different to that.
And of course, from a hormonal perspective as well, as women, our hormones shift and change monthly, yearly as we age. We're in constant flux with our hormones. How does hormonal changes, or how do hormonal changes impact pelvic floor health? And then, of course, that interconnection with the vagus nerve. Let's talk about that.
So, women have quite a unique journey in their bodies from a hormonal perspective, and there are key changes that happen in the pelvic region based on what hormones are doing. So there's a lot to that conversation. So we're in a high hormone state, so lots of estrogen. Our vulval tissues are plump, our bladder is more stable, our urethra is firmer and more mobile. When we go into low hormonal states, our connective tissue gets stiff, our bladders get a little bit irritable, our pelvic floor gets a little bit dry and stiff. So that's really, I guess, more well known when we're going into menopause or perimenopause and we're having low hormonal states. That collection of symptoms of like bladder irritability and vulval dryness, that's called the genitourinary syndrome of menopause, GSM. It can also you can have little windows into that premenstrually. So when we drop down in estrogen just before period, a lot of patients with sort of pelvic floor weakness can notice that they're more vulnerable to things like leaking, urinary incontinence just before their period. So they'll say, look, I can run every other time of my cycle without wetting my pants, but that week before my period, it just for whatever reason. And that's reflective of changes in estrogen. So reduction of estrogen, reduction of that support around that genitourinary region. When we're in high levels of estrogen, we actually become a little bit more mobile and stretchy. So we know that athletes, so female athletes that are in a high hormonal state, say ovulation, for example, they've got a higher risk of having like a catastrophic injury like an ACL. And that particular injury is far more common in female athletes than what it is in male athletes. So I guess that's a good example of how hormones will change what goes on in the pelvic region, but also the general musculoskeletal system at large. And there's different implications from low hormones to high hormones. In terms of the relationship between hormones and sleep, we know sleep is really affected in pregnancy. So high rates of sleep disturbances in pregnancy, and with lots of different reasons. So it can certainly be hormone shifts. We know that progesterone really jumps up when we are first pregnant, and that's to help the placenta. And it's the first thing that needs to go to be able to grow, to be able to sustain life of that little person. And progesterone competes with cortisol. And so progesterone is prioritized because we need to metabolize that to be able to do things with the placenta. So we're left in a higher level of cortisol state in our bloodstream. So that can be one of the ramifications. Poor sleep onset can be a significant change for some people as soon as they're pregnant. There's lots of other reasons. Things can become uncomfortable, cramping, musculoskeletal reflux. There's all sorts of things that can interrupt deep sleep in pregnancy. Of course, having a baby will have more changes with sleep. And then when we go all the way into that perimenopause state, again, poor sleep is a really common change that people start to notice alongside of things like general musculoskeletal aches and pains and changes in periods. So women have quite a complex journey with hormones and sleep and overall pelvic health and well-being. So it's I guess the message, Tammy, again, is it is really all interconnected, and figuring out ways to optimize sleep, but also recognizing that it is a common thing to be affected at different stages of a woman's journey, and being able to make the most of the situation and having good strategies, is really important.
I think it's really important for women to understand what actually happens to their pelvic floors and the surrounding organs, let's say, as we age. Because I think, and I'm bringing this back to a health and fitness perspective, because from my perspective, I see many influencers out there really pushing women to, I'm all for women training hard during pregnancy, but we need to be very mindful of our pelvic floors, because as we age, there is so much change and shift in our hormones. And then this is then going to affect our pelvic floors. And what you do in pregnancy, it can be fine now, but then it can show up later down the track. And women are living longer. I'm going on a bit of a rant here, but you can't compare women that were dropping babies in fields and keeping on working a few days later to what we're doing now. And this is what I'm seeing out there in social media land. They're comparing how women used to work and being in fields after giving birth to us now. But what people aren't realizing is that we're living so much longer, and there's so much change that happens to the pelvic floor as we age. And this is things that they're not taking into consideration and protecting it at this point in their journey, because it's a long journey, right? And there's lots of ups and downs. So we need to try and protect our pelvic floor, because it's going to go through changes later in life as well.
I think that you're referring to is the lifespan model of pelvic floor dysfunction, and that was brought to life by a really famous researcher, John Delancey. And looking at that idea of the function of the pelvic floor over a woman's lifespan and all the different things that occur in the pelvis, which is really unique for a woman, particularly if they choose to be pregnant and they choose to have babies and they choose to do that more times over than one. And then what happens like after that in terms of aging and menopause. And so everyone has a symptom threshold, and say you're at your mid 20s or your early 20s, we'd normally see people at their peak of their pelvic floor health. So it depends on connective tissue and choices of sport and activity and factors and different things. But typically people are at their peak of their health and they've got lots of capacity and low risk of symptoms. This is generally speaking. And then say we're at the top of the curve, and then things start to happen where we dip closer to that symptom threshold. And that can be a pregnancy or a traumatic birth, perhaps. And what we look at from a pelvic floor perspective is we're looking to always push them up away from the symptom curve, so that their chances of having things like urinary incontinence or prolapse or fecal incontinence or sexual dysfunction is lower. And our job is to prevent that, or if they do dip into that we push them not just a little bit above, but well above the curve. And you could see that with the same idea that you're talking about is with your exercise. You're choosing good exercises to build strength and resistance and to be strong and improve mental health and improve physical capacity, but without compromising pelvic health, and better to promote better levels of pelvic health. Because over the lifespan, if we can keep people away from that symptom threshold and to maintain control over their bladders and bowels, then we've done our job well. But we know if we rush all the way to the end of life, the second most common reason that people are admitted into nursing home is because they can't manage their bladder and bowels. And people don't think about that, but we will often talk about that statistic and put that as our North Star for patients, because perhaps it's not happening now. Perhaps you're not soiling your pants at the moment, but that feeling of if it does happen is a huge impact on quality of life and confidence. So we want to avoid those moments with all of the things that we do before stage of life. So I think it's good that you've got that lifespan model in mind and you're promoting not just physical whole body health and well-being, but you've got that awareness about also promoting and not compromising pelvic health during these more vulnerable moments of a woman's journey, which is pregnancy, is postpartum recovery, and again in that perimenopausal state.
And then also bringing into play all of this central nervous system vagus nerve, vagal tone aspect of it as well, and making sure that they're looking after their mental health, I suppose. So in terms of all of this, how can pelvic floor therapy help in improving that whole vagus nerve function? Because you have spoken about working with them. Like, what does that look like?
From your perspective, from an exercise perspective, we know that when women are exercising, that does promote vagal tone. We know it reduces stress, it improves immunity, it reduces inflammation, unless it's too hard and too crazy. But it does all of those good things, and it keeps people connected into their body and feeling well, confident, emotionally more stable, promotes sleep. Like, exercise is absolute medicine. So we know that pelvic floor symptoms can be a barrier to people really engaging in those healthy routines. Women can start to make choices, say they feel not confident, say that they're feeling vaginal heaviness, say that they're wetting their pants, say that they're not able to control wind through their back passage. They tend to step back from exercise and not necessarily realize that there's consequences to that. But again, over time, what you do over time can have big implications in the future. So as pelvic health physios, we're really looking to make sure that the pelvic floor symptoms are not being a barrier for them to be able to engage in things that promote health and well-being. And exercise is a really big one, and we're such strong advocates around women staying engaged in physical activity with whatever it is that they love doing. And and then we know that's a key pillar for all the other things that we've talked about in terms of nervous system regulation and sleep and immune system function and lowering inflammatory levels. So it all goes together, but we do know that good levels of pelvic health can promote active engagement, and poor levels of pelvic health can actually be a major barrier in women stepping forward and participating adequately in exercise programs over a long enough period of time to gain those benefits.
So in terms of this, because we've talked a lot about connection being one of the key pillars of health, essentially, how does social support networks, or how can your social support network influence your recovery from pelvic floor disorders? How does that all play in?
So we talked a little bit earlier about that we are social animals. So for us to really flourish, we need to have that social support system in place. And for that to flourish, we need to be able to access that ventral nervous system. That's when we have that oxytocin. And in essence, that's when we create those positive social connections, which is so protective with emotional and physical health long term. We know the impact of loneliness is even more impactful than something like smoking. So it really does speak to the heart of us as humans. We need that connection. We need that bonding with other people. And so what can interrupt that with pelvic floor symptoms is that sort of stigma and embarrassment that can occur, and sometimes the lack of language that people have to feel comfortable and confident and clear in describing their symptoms. I feel like that's improving a lot in the last 5 years because of how much more knowledge there is around pelvic health, things like sexual pain and a lot of promotion around urinary incontinence. I think that's really helped. We know that people that have persistent pain, there's research to say that if they have good, strong social connection and support, they actually do better. Where if they are more isolated and they don't have people around them that understands what they're going through, that can actually predict a poorer outcome. This idea of being connected in and having positive support networks and being able to feel comfortable in explaining symptoms and getting that support network is really critical for humans to flourish and to do well.
And there has to be an aspect of empowerment in there as well. So feeling empowered to, and I guess that would be part of your role, is like 100% like what you would do is the same as what I do a little bit, but in a different sense, but empowering them.
Yes,
To manage their own symptoms and what's going on, and giving them the tools to actually do
absolutely.
that.
That sits at the heart of what we do around that sense making, so they understand what the feelings are that they're having in their body. What are they and what do they mean? And what are the tools that they have, or what are the tools that they need to help to manage them? And we know that if we've linked that story together, I understand what's happening, I've got the tools and I've got the support network around me to manage, people do so much better. So they could have exactly the same symptom, but the distress that they feel is completely different because they know what it is, they know how to manage it, and they've got a support system. So if they fall off again, they can just quickly come back in. But people don't do well if that structure isn't in place, and that tends to really drive that level of distress, fear, concern, worry, and anxiety. So that component about connecting the dots and empowering people with the knowledge and the skills and the support network allows them to really flourish and feel confident and a level of self-efficacy around it's going to be okay.
I love that. I love that so much. And I feel like we've gone in a really beautiful loop back to what we were saying before. And I think that's a really nice place to finish this conversation up. But before we do, I have one question that I ask everybody. And I've asked you this before, so you're welcome to answer this in any way, shape, or form you like. If you had one piece of advice to give any woman before she has a baby, what would that be?
To understand what's about to happen and to have skills to be able to promote a good outcome, and to understand if that doesn't happen, that there are people around you to support, lift you back up and help your recovery, just like we do with our female athletes. So knowledge is power. Lean in, learn more, develop skills, and then know that there's people in our community that have expertise to help promote good outcomes, prevent birth injuries. But if birth injuries do occur, there are people around to make sure that you get the best possible outcome and recover.
Absolutely. And if you're lucky enough to be in Sydney, then you can certainly reach out to Angela and her team at Sydney Pelvic Clinic. In my eyes, they're the best. So highly endorsed here. So Angela, thank you so much for your time today. It's always such a pleasure, and I appreciate your time because I know you're so busy. So thank you so much. It's been such a wonderful chat.
A pleasure to just talk to you, and thank you for all the good work that you do too, Tammy. It's been a fun conversation.
And if you're hearing this message, I want to say a huge thank you because it means that you've listened to this entire episode. Of course, if you have any questions about the things that we covered in this episode or want to know more about me or my other projects, you can find me on YouTube and Instagram at The Pregnancy Process. For those currently in their conception or pregnancy journey, you can apply to join my complimentary but private community, the Preggy Training Crew. And you'll find my community application and social media links in the episode description. And of course, if you enjoyed this episode, I absolutely encourage you to share it with other women just like you. And I look forward to seeing you in the next